Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. This past year, with the world in the middle of a pandemic, has been lonely and challenging to say the least. We've made great strides in public health to help fight COVID-19, including the development of the COVID-19 vaccine. And we're here again today, masked up and 6 feet apart, to talk about the COVID-19 vaccine and some of the health disparities that have shown their faces in our community. Joining me today are Dr. David Bishai, Harford County Health Officer, and Dr. John Sampson, Associate Professor at Johns Hopkins University. Thank you both for being here very much, and welcome again. This is kind of a continuation of our show for our vaccine part one, kind of where we just really touch the surface of the impact that the vaccine is going to have on our community. And so we're here again, part two. And let's just start off with some general vaccine questions and answers. Questions and answers we're seeing a lot, so kind of like an FAQ kind of thing. Dr. Bishai, is the vaccine safe?
That's a great question, and we're so glad to have the evidence to give a very conclusive answer. When we test a vaccine for safety, we do it in 3 phases. The phase 1, we try this in a small group of human volunteers to look for any side effects, and then in phase 2, we tried at different doses and in different subpopulations, and in the largest trial, we tried in large groups. So we've tested the Pfizer vaccine on 40,000 people, the Moderna vaccine on a sample of 30,000 people. We watched these volunteers now for up to 4 months. We've charted off. Everybody in the trial was asked, what are your symptoms, what are your side effects, how are you feeling? And they fill out logs of symptoms and side effects early on and on a continuing basis. So now 4 months later, with 70,000 people of various ages, not younger than 16, not under 18 for the Moderna vaccine, but various ages, even balance of men and women. A large number of minority groups, about 10% of the participants were African American, and none of these groups are showing any extra chance of serious, severe side effects. Many are having a sore arm, a few hours or a night of restless sleep or malaise or fatigue, like your body's immune system is acting up. So none of these symptoms are anywhere as bad as the most serious forms of COVID-19. Even a mild case of COVID-19 in my book is going to be worse than this because of the social meaning. If you get a case of COVID-19, your family's going to have to quarantine and you could spread it to people you love. So these small side effects are insignificant compared to how bad it would be for even a young and healthy person to get a case of COVID-19 and threaten the safety of the people they love.
So what would you say to people who you kind of hear the chatter saying, well, this vaccine wasn't tested, it wasn't tested enough, and we had surveyed people in Harford County, and some people were cautious to get the vaccine because they felt that the vaccine hadn't been tested on enough people like them. So they were they may be African American and they felt like the vaccine hadn't been tested on enough people. Dr. Sampson, what would you say to that statement?
I think that is a valid, cautious concern that people would have. And the interesting thing, though, is that the research for this vaccine happened before the pandemic existed, because they were already researching this new technology for making vaccines with messenger RNA. And they were able to then leverage that research and then use that for the development of this, for this particular vaccine. In addition to that, early on, as soon as DNA sequences were available for studying the vaccine, China actually released some of that data to help them to jumpstart their movement. And then, of course, the federal government put in additional money that gave them more resources than they would normally have. In addition to that, because of how widespread the infection is, obviously, they were able to use social media and quickly recruit people to enroll in the vaccine. So because of this overall multifaceted effort, there were many different things that came together to make this vaccine quicker. Now, in addition to the 3 phases that Dr. Bashai has mentioned, technically the 4th phase is the actual delivery of the vaccine to the population. And of course, by now, we've gone through phase 1A and 1B, and then 1C, and then 2. So all of those different people who have been getting the vaccine since the beginning of this year, additional data has been collected on them as well to further confirm the safety of the vaccine. So at this point, so many thousands, tens of thousands, hundreds of thousands of people have received the vaccine, and they've got all of that data to verify that it's safe. So they're not really the first people getting the vaccine.
Right.
They're not early on. This is not something that they're part of an experiment for.
Right.
They're part of the implementation of this to basically try to eradicate this pandemic.
Right, and when we surveyed people, there was kind of like a 50-50%, 50% had an interest in getting the vaccine and 50% didn't have an interest of getting the vaccine. But we have seen so much interest in Harford County, Harford County alone getting the vaccine, and really all over the state, that, it's not surprising, but it's maybe what we were not expecting. Or would you say we were expecting that, Dr. Bashai?
No, I had always known that there would be people who would be the front of the line. There's always going to be that. What we still are waiting to see is when the people at the front of the line are done, do we start to slow down at 50% of the population, 60%? I know that it's hard to get up to 95%, and I don't really see that happening with COVID-19 demand, other than if we really put a push on it, or start to make the benefits of it extremely clear to everybody. So I think obviously there are people who know how lethal this is to them in the 1A and the 1B and the 1C group. Once we get to group 2, once we get to regular ordinary people, then it becomes a matter of really demonstrating to them that they are better off with this protection than without it.
And so you mentioned about children under 16 and under 18 cannot get the vaccine. Do you know why anybody younger than that cannot get the vaccine?
The reason is that the trials, the phase 3 trials of Pfizer, did not include anybody under 16. And the phase 3 trials of Moderna did not include anybody under 18. The reason for that was speed, that it takes longer to get parental consent and to recruit children in scientific studies.
Sorry, go ahead. Is it something that you think children will be looked at in the future, that they would be able to receive the vaccine?
Yeah, there are already efforts around to include children in this year's ongoing study. So by the end of this year, we hope to have data on the safety and efficacy of a COVID vaccine that can include children.
Okay. What can somebody expect just walk me through, what can somebody expect, say, when they have their appointment to get their vaccine? Just walk me through the process.
Great. So on the day of your vaccine, you have to check yourself and make sure you're not sick. Make sure you don't have a fever or malaise or loss of sense of taste or smell. And if you do, you don't come. You would call to cancel your appointment. Wear loose-fitting clothes that you can easily roll up your sleeve to get to the upper part of your shoulder. If you want to bring a friend for support, bring a friend for support. Come just a little bit early, 5 minutes early would be fine. You will go up to a greeter at the registration desk, give us your name. We are wanting to ask to prove that you are a 1B or a 1C, so be able to show that, yes, I'm a teacher, or yes, I'm a dentist, whatever qualifications you have, be prepared to show that to the people at the clinic. We will review your eligibility. We'll again ask you questions about any bad reactions to vaccines, review your age, making sure you're over 18, making sure you're not pregnant, and after you've consented for the vaccine, you'll get a shot. You get a Band-Aid, and then you'll go over to an observation unit where we observe you for at least 15 and sometimes as long as 30 minutes to make sure you're not having any reaction. And then you take a selfie, and we have little boards for you to take a selfie at, like you're a movie star, and you can share your good news with everybody. It's actually a really important part of getting vaccinated, is to tell people that a person you love is vaccinated, and a person you love has made the right choice.
Right.
Spreading the news about your right decision is really an inspiration for all of us.
Right, and then you talked about, Dr. Sampson, the importance of, our community leaders and people we look up to in the community to kind of, there are people out there that are pushing the vaccine, and there are groups out there that are really trying to engage the community and those hard to reach populations on getting vaccinated.
Right. So there's a number of different webinars and different online meetings that have been taking place live here in Harford County that have been organized by Upper Chesapeake, organized by the different fraternities, sororities, churches, other community organizations. And I encourage someone to just look, actually they can look through social media and they can probably connect to one of these and actually ask any questions that they have. They can ask it and get answers in real time with the rest of the community as they engage in addressing any concerns that they have or questions they have about the vaccine or about coronavirus infection in general.
Great. What about the side effects for the vaccine? We briefly touched upon them, but what are the minor side effects, and then what are the major side effects that we're seeing, Dr. Sampson?
Okay. So the probably most frequent minor side effect is simply pain in the arm. And most of the people seem to not necessarily have pain in the arm right when they inject it. The injection really doesn't hurt that much. But when they wake up the next morning, they may have some pain in the arm. And sometimes it can be a little mild. I myself had zero pain in the arm, but I know that other people, some of my colleagues, had quite a bit of pain in the arm. So within a day or two, it was gone. Others are just a headache. For me, it was a small nuisance headache that went away within 15 minutes of taking a Tylenol. And then once the Tylenol was metabolized, after about 4 hours, I got the headache back. I took another Tylenol. The next day, no more Tylenol, it was actually gone. Another one that's common, which I myself personally experienced, was just a little bit, for some reason, I didn't feel like sleeping, and I wasn't sleepy. Of course, that didn't make it great for the next day because I was sleepy while I was at work. But that was not really a big thing. It was just kind of like, I didn't sleep very well last night.
Right.
And then the next day, I slept fine. Others are some people, I did not have this, but some people have a fever. Some people just feel malaise, or they feel like they just don't feel that well for a day, and then they feel better afterwards. So those are some of the minor ones. And then it can go all the way up to the most serious one, which would be an anaphylactic reaction. And that would be something similar to an anaphylactic reaction to a bee sting if you're allergic to bees, or anaphylactic reaction to peanuts if you're allergic to peanuts and you ate one. And those cases, just like those types of anaphylactic reactions, you would treat it with an EpiPen. And so the people who are giving the vaccine actually are equipped for that, and that's actually exactly why they wait 15 to 30 minutes. They wait 15 minutes for most of the standard people, but if you have a history of having had more serious allergic reactions, then they want to just make sure and just have you be observed for 30 minutes, because after that, the likelihood is very, 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 very unlikely that you would have any kind of reaction, serious reaction like that after that 30 minutes.
So your side effects are really only like 24 hours, right? After
some people can be up to 48.
Okay.
24 to 48. I'm not aware personally of any ones that lasted beyond that.
So I heard somewhere, so correct me if I'm wrong, that if you have, the more reaction you have to the vaccine, the stronger your immune system is. Is that factual at all, Dr. Bashai? Have you heard anything about that?
I don't know what I would measure the strength of your immune system as how many antibodies you're about to make, and I don't think that's what's happening. But your immune system is giving you symptoms. That's just good news for you. That I'm getting my body is doing what it should do. It's setting up the immune system to learn about the shape of the virus. It is not a real virus. It is simply the mRNA that goes into your muscle cells. Your muscle cells begin to make structures that look like the coronavirus, but it's not. It's not the coronavirus. It's just the spike protein. And your body's immune system recognizes it and learns it. And as any good immune system will, it also can sometimes cause a pain or a headache or other side effects.
What about vaccine immunity? I've seen information that, well, the vaccine's only good for 90 days. But in fact, I don't believe that is a true statement, right?
Well, we are learning how long the immunity lasts by following the people who got it the earliest, which was late last summer. By following their antibodies, we're learning how long the immunity lasts. And right now, we're in 4 months of observation. So far, so good. But we won't know until we've watched people for more and more months about how long the immunity lasts. But the answer right now is so far so good. It looks like the immunity lasts. If we learn that it doesn't last, we will use boosters.
Okay.
And that's how we'll prolong the immunity. But that is something to learn over the summer and fall of this year.
Similar to other boosters, we would use, as children, they get their booster shot for something, right?
We would learn where we need to boost it. And the beautiful thing about the mRNA vaccine is that the discovery was how to package mRNA in a lipid envelope. But it's almost like a CD player. You could swap a new mRNA strand into the lipid envelope. So and I am worried about the mutant strains.
Yes.
And if these mutant strains begin to be a problem, the factories that are making this version of the vaccine could swap in the new mRNA, and the production capacity is there. It's just a matter of the science to show that the new mRNA strand of the mutant could be swapped into this vaccine platform. So it's a platform for rapidly switching off the type of immunity we try to train the human body to make.
So that was another question I had about the mutated COVID-19. I saw something on the news saying we haven't seen anything yet compared to what is coming down the pike with the mutation of COVID-19. And I thought, my gosh, we've already seen so much and had so many issues and hurdles to overcome in the past year. How could it possibly get worse? But you're saying that there's a positive side to that, is that we can modify the vaccine.
We could rapidly adapt the mRNA platform. I would want to say that it's just not the time to be alarmist about what the mutations are about to do. They're out there, but they have to compete. They're overnumbered by ordinary, everyday coronavirus. The COVID-19 virus that is out there is outnumbering the mutants by thousands to one. And so that poor little mutant is trying to swim upstream and get to us through this crowd of ordinary COVID. It can happen, but I think it's just not the time. There's no evidence that that's actually happening, that the numbers of the mutants are swamping it out, or that the vaccine is ineffective. The vaccine for the B117 strain from the UK, people who had the vaccine gave their blood samples, and the serum was used to try to neutralize the mutant virus, and it did. The antibodies that they got from the vaccine neutralized the mutant virus. There was a South African strain as well, and the antibodies from the volunteers in one study were not as effective at neutralizing the virus, but in another study they were. So it's too soon to tell whether or not these mutants will require a real modification to the vaccine. Right now, we're good, and we do need to be vaccinated against the most common strain of the SARS-CoV-2 virus.
And so if you've already had COVID-19, Dr. Sampson, do you still need the vaccine? I mean, I've already had it. I feel like I'm immune for, 90 days, essentially 3 months, you're immune. Do I still need the vaccine?
So right now, based on looking at people's antibody levels, it looks like for at least probably 3 months, you probably have some immunity that is going to protect you more than likely from getting an infection. But after that, the immunity goes down, apparently, and there have been a number of people who have had repeat bouts of coronavirus infection. It turns out that the technology for making this vaccine, this new messenger RNA vaccine, is such that it produces a lot of the protein that your body is learning to react against, a lot more of that than you would have in the case of an actual infection. And so what that means is that it's supercharging your immune system, apparently so that that immunity lasts longer than it would if from just a natural infection. So the recommendation is that that you're good for the first 3 months, and certainly we want the vaccine to be concentrated on the people who aren't protected, not the people who may actually have some natural immunity. But after those 3 months, the recommendation probably is like by 4 months that you should also be vaccinated.
Okay. What about, we hear the term herd immunity, and we kind of use that term loosely, but what does it, can you define, Dr. Bashai, what exactly is herd immunity and how do we get there?
Sure. So first I'd like to start with an analogy of what an infectious disease is. An infectious disease goes from one person to others. And in COVID-19, originally at its start, when we were living ordinary human lives, one person could easily infect 2 or up to even 4 people. An average person would infect 2 to 4 others living an ordinary human life. No mask, no social distancing. And that's why we are modifying human life, living like this here in the winter of 2021. Now, what herd immunity does is it stops the chains of transmission. So if this were a wildfire, a burning tree would have to spread sparks to another burning tree. Well, if all the trees socially distance or wear asbestos masks, that burning tree cannot infect another burning tree with fire. Or you could move the trees, socially distance our forests, wrap our trees in asbestos, or if we could immunize the trees, then the burning tree can't infect another tree. So by immunizing the herd of people, we are essentially allowing the forest to become denser, and a burning tree that tries to send a spark to an immune tree can't set it on fire. So in herd immunity, we are sort of protecting the other trees in that forest, where that one burning tree cannot possibly set another one on fire. Different types of virus are more likely to send their sparks out. They're more likely to flow through the air. They're more likely to set up a fire in the place they land. And because of those properties of this virus, we've calculated mathematically that getting about 70% of the population to have immunity is enough to make the fire not spread. So that if one person with the disease is out there coughing and sneezing, as long as about 70% of people are vaccinated, they might get it to maybe one person would infect a half a person, or one person would infect 3/4 of a person, meaning 10 would infect 7.5, or 10 would infect 5. And eventually the fire dies down. So herd immunity is relative to how crowded and dense we are, what kind of lives we want to live. We found places in America without a vaccine were able to put out their fire simply by masking and distancing. We don't want that. We want to have our lives back using our own body's immunity so we can get back together, take off our masks, go out and hug people again. That's what we want to do. And we can do that if, instead of the distancing and the masks, we use our body's immune systems to shield us from catching the virus from another infected person.
And so you brought up a good point. We want our lives back. So, you know, when we reach herd immunity, Dr. Sampson, how can we go back to normal right away? Do we still have to mask? Do we still have to social distance? Like, what do we, how about this question? If you get vaccinated, do you still need to wear your mask and socially distance?
So first of all, the vaccination, protection rates are like 90 to 95%. So there's a small chance you could get coronavirus infection, and and even be infectious to someone else. It's not a high chance, but there's a small chance that you could do that if you're vaccinated. That chance becomes more and more insignificant, less significant, the more people are vaccinated, right? So if lots of people are vaccinated, then that chance becomes much smaller, all right? So for right now, until we get to that point where that Dr. Bashai is talking about, of having herd immunity, then we'll follow the public health experts like Dr. Bashai and Dr. Fauci to take their guidance as to, how our process of returning back to normal. But for right now, we need to do the same things generally that we are until we can get to that point where a larger percentage of the people are vaccinated.
And what about this vaccine shortage that we're seeing, especially in Harford County, but around the country, there's a vaccine shortage. Is this going to be a shortage forever? Are there more vaccines being produced? Do we just need to be patient? Like, what would you tell people who are eager to receive the vaccine and can't really get it right now?
The first thing I would say that you're blessed actually to be in Harford County, because people in other parts of the country are having a way more difficulty getting access to the vaccine because of inadequate vaccine supplies. However, regardless of what part of the country you're in, that's changing rapidly because they're ramping up. Pfizer and Moderna are ramping up the amount of vaccine that they're making. There's another vaccine coming out from Johnson & Johnson. Now you're going to have 3 companies making vaccine. AstraZeneca, and there's other companies that are getting their vaccine pushed through the testing. And once it gets through the testing, if everything pans out and it's proven to be safe, then those vaccines will be authorized for use, and then there's even more available. So the amount of vaccine is just constantly increasing, and the federal government has really put together a plan to focus on getting that vaccine out, to actually produce enough vaccine to meet the needs of the population at the rate that they're going to for 1 million to 1.5 million, I think, per day of vaccinations, or per week vaccinations.
That's great news to hear, I think, because people are kind of upset that there's a shortage and they can't really get their vaccine. If you believe it, we are out of time. We have about a minute left, so I just want to say that get the vaccine when it's available to you, right? It's safe, it's effective, and the sooner we can get everybody vaccinated, the quicker we can return to our lives, right?
That's right.
All right, great. Well, that is all the time we have today. I would like to thank my guests on today's show, Dr. Bashai and Dr. Sampson. If you would like more information on COVID-19 and the vaccine, please refer to the resource page after this program, and join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.